Good afternoon. My name is Dr. Mark Freeman, and I'm the new medical director for Telemedica LLC. They are the experts in mental health assessment, and we actually are coming on board to help with the physical health assessments. But as it is, I'm currently the medical director for our company called Access Medical Solutions, and we provide and attend to veterans to do disability medical evaluations for those benefits that we believe if you serve, you deserve. In any case, I'm new medical director for Telemedica, and I'm on board today to discuss with you our topic of the day, which is chronic pain. I have a question to ask right off the bat. First off, what is pain? And the second question would be the reasons people seek medical attention. Let's go to the second first. Let's say what are the major reasons people even seek medical attention? Well, number one is pain. That's the number one reason people seek out medical attention. And even if it's an earache or a sore throat or a broken arm, it's all related to discomfort or some sort of pain. The number two reason people seek medical attention is fear. Fear of the unknown. Doc, I have a lump in my breast. Is it cancer? Or no, it's just a fibrocystic nodule. We're going to look at it and make sure as long as it's not cosmetically inappropriate, we're going to do a watchful waiting period and we're going to monitor it. But it takes you back again, fear of the unknown, and because they don't know if they're going to develop the end stage or pain. So it's really fear of developing pain or a condition that can cause pain. So, pain is a very big topic in the practice of medicine. Now, keep this in mind. My specialty is preventive occupational and environmental medicine. You could remember the acronym POEM, but the whole deal about prevention is that we take a proactive role and an approach to attending a patient's needs, in this case, veterans' needs, as opposed to conventional medicine, where they actually take a reactive role. If you got a ill, take this pill. Well, in preventive medicine, we try to proactively identify with early detection uh, and intervene with early intervention so as to prevent, hence our specialty of prevention, preventing further chronic debilitating diseases. And so, as a proactive approach to preventing chronic debilitating diseases, we assess risk factors and we stratify those risk factors in uh, mild, or a low, medium, moderate, or high, and we attend to those needs, those risk factors, such that the veterans and or the patients do not manifest into chronic debilitating diseases. Well, getting back to our topic, pain is the real reason medicine exists. And where does what, and now the first question I ask, what is pain? Pain is actually one of the manifestations of the body's immune system or defense mechanism for any type of insult, whether the insult is traumatic, I broke my arm, or infectious, I got a bacterial sinus infection, or infestatious, I got some parasite on board, or a fungal infection on my skin. So the whole deal is that we try to address the issue, mainly not the symptom of pain, but the issue of the cause of the pain. So, going back to the ancient Greeks and those the originators of modern Western medicine, if you will, even the ancient Greek physicians recognized that inflammation was the initial defense mechanism of the body, and their recognition of inflammation came about. They called it rubar, kalar, tumor, and dolar. Rubar, as in ruby, means red. We could see that. Kalar, as in calorie, is a form of measurement of heat. Tumor, as in tumor, is a manifestation of growth or swelling. And dolar in Greek meant pain. So, of the four manifestations of inflammation, redness you can see, uh, um, heat you can feel, swelling you can see, but dolor or pain, you can't use your five physical senses to assess. And so it's really a subjective finding. We call those symptoms. So the other three were signs. Pain happens to be a symptom. So, as such, what we know is pain is a manifestation of inflammation. And so, what we should do in our practice of proactivity, we do a analysis to find out what is the root cause of the pain. Hence, you might be familiar with the term root cause analysis. And so we believe the appropriate approach to attending to the needs of the patient who comes in, as we know, is going to be because of pain or fear of developing pain. We'll do a root cause analysis and find out what is exactly the cause of this pain. And then we'll address that cause. And if they address the cause and attend to the needs of the patient appropriately, the pain should subside. Now, I know in conventional medicine and their wisdomry, as if you and I always use the euphemism, for this ill, take this pill. But it is a reactive approach, and they quite often try to treat, if you will, or mask symptoms. Treat the symptom of pain with pain medicine, well, analgesia. But when the analgesic wears off, if you haven't treated the cause, the pain will return because it's a manifestation of inflammation, which we now know that inflammation is the body's first mechanism of defense against any insult. And so it's quite often that people can relieve their pain, especially in an acute setting, uh, with those non-steroidal anti-inflammatory medicines or anything that'll tend to the inflammation or inflammatory process and will help relieve that symptom. But in the case of chronic pain, now we'll define acute in the common medical community is 6 weeks or less. In the setting of the VA, they define chronic greater than 6 months. So acute somewhere less than 6 weeks, let's say. Chronic is greater than 6 months. So there's another sector called subacute, somewhere between 6 weeks and 6 months. So we we believe that anybody who has pain greater than 6 months, which is defined as chronic in the Veterans Administration, uh, should be addressed through a root cause analysis and find out what's the cause of their pain and attend to that the best that they can. So sometimes, even after attempting the attention to the root cause of their pain, it's not alleviated. And sometimes people do end up with a chronic intractable type pain scenario and they require analgesia, but also um, other means of reducing inflammation. A lot of times it comes with the more appropriate nutritional support and or movement support, rehabilitation. But in any case, we've talked about pain as as a symptom of inflammation, and we talked about the whether it's acute or subacute or chronic, and then we've talked about some of the attention that needs to be made in order to assess the pain. So we assess the quality of the pain and the quantity. And that that terminology should be related to qualifying if the pain, what's causing the pain, hence the root cause analysis, and then quantifying the severity of the pain and addressing it as appropriate. In other words, you must address the a, a, sev- a severe pain with severe approach or a more moderate approach, and then less pain with a less severe approach. So anyway, we see people in our clinics all the time that have symptoms or complaints of pain, but the biggest advocate of addressing their needs is to do a root cause analysis and attend to the cause of their pain. Hence, this is our proactive approach. And so I think we've discussed, to reiterate, what pain is, where we classify it as chronic or acute or somewhere in between, which is subacute. We also described that pain is really a symptom, which is subjective, not objective. You can't use your five physical senses to assess it. We also address the proactive way to approach the assessment is by doing a root cause analysis and attending to that cause. Hence, we're doing the greatest justice for the patient seeking medical attention. I think that that covers our topic of pain. I'm sure there's going to be some questions. We talked about developing a plan of intervention. We talked about, the different severities um, of pain. I just wanted to reiterate that in our practice of proactive medicine, we qualify the condition, we quantify the severity of the condition, we do a root cause analysis, and we try to attend to the root cause of the pain as opposed to just putting a band-aid on the cause by treating a symptom, which is all subjective and not objective, as the conventional physicians do. Now, I think that ends our discussion on chronic pain. I'm sure there's going to be some questions. I do want to add one thing, that pain not only comes in physical, but it comes in other forms such as psychological and emotional stress. These are all pain points which must be addressed as well. And so telemedica, the experts on assessing mental health, and as far as emotional and or psychological pain, which it could be noted as stress, and Access Medical Solutions does the same thing as experts in assessing physical manifestations of pain. So if there's anything that you might need as far as questions, you're always able to contact Telemedica LLC on their website through the contact us, or visit customer support at telemedicallc.com, or call, which the number's on the website at telemedica.com. Again, this is Dr. Mark Freeman. I'm the new medical director for Telemedica and the medical director in existence for Access Medical Solutions. I'm welcome. I'm open to fielding any questions you might have. I appreciate you watching. Um, if there's any questions, might we field them now? I see. How do we go about addressing our pain through the VA, whether traditional or alternative? Which is a good question. So traditional, again, we talked about, that's the conventional way of allopathic, conventional way, which is mainly reactive, and they address the symptom of pain with analgesia. Some people are more open to being uh, proactive in addressing the cause of the pain. And you say traditional or alternative. There are alternative methods. We mainly use a complementary. So complementary and alternative medicine is classified such because it's a combination of a naturopathic approach with an allopathic approach. The allopathic medicine is the conventional medicine that we learned in medical school. The naturopathic is a different field of study, but if you use the best of both worlds, that's very complementary, and actually the patient wins out. So the different details of addressing whether traditional or alternative, I should say that it should be a combination of both, taking the best of both worlds and addressing the needs of the patient specific to what's their cause of that symptom, the symptom of pain. Very good question. Any others? Any other questions? It's questions from James. How do I express my pain to the VA? I don't seem to get to understand what I am experiencing. Very good question. So keep this in mind. The VA is divided among three flavors: the VHA, which is Veteran Health Administration, and they're tasked with providing you medical care for your health and well-being. The VBA is which we are actually contracted with to provide you with evaluation of your disabilities for your benefits. And so when you're talking to the VHA and your primary care managers, your primary care physicians about your pain, make sure you describe what you're feeling in those the sense of those manifestations of inflammation. So whether you have rhubarb, dolar, kalar, and tumor, and then you describe where it's located, and you describe the location, what might initiate this pain, what might alleviate these pains, some of the characteristics of the pain, whether pain stays local or is radiating, and they should know that there's a systematic approach to assessing the pain as a symptom. But the biggest thing is trying to analyze your pain such that they can find out the cause or the etiology and address that cause. Very good question, James. Anything else? Dallas, can a combination approach help with root cause analysis? A combinatory approach help with root cause analysis? Well, again, I absolutely. I think that the root cause analysis should be addressed in a combined effort from the techniques that are taught in allopathic medicine and maybe the techniques that are taught in interventional styles of naturopathic medicine, meaning there's certain areas of medicine that you can utilize one better than the other depending upon where the pain is, whether it's a musculoskeletal pain or gastrointestinal type pain. And so some pain are easy to recognize, especially as an objective finding. If you're on the outside looking in, for instance, uh, uh, a sprained ankle, you could see that it's red, it's tender to palpation, it's swollen, it's uh, rhubarb. It's hot, tender, swollen, and painful. So, but it's sometimes difficult if the pain is on the inside and it's involving your GI tract or it's involving a nerve or something. And so you're going to have to describe it as the physician, the attending physician, if he's attending to the root cause, just describe it as you see fit. And all you're supposed to know how to do is explain what you feel, what you see, what you hear, how you use your five physical senses, and then he should be able to take that information and address it to the cause. But that's a great question. It should be a combination. Anything else? No other questions right now? Well, listen, I hope that you understand that pain is a symptom, not a sign. You can't use your five physical senses to assess it. So you should assess the cause of that pain and so attend to the cause. Although pain being it's a symptom doesn't mean you should neglect it. It means you should find out what's causing it because that's the number one reason people seek any and all medical attention in the first place. Again, I want to thank you for watching. Make sure you visit Telemedica LLC. If you need to have any other questions, go to customer support and or you could call them on their website, telemedicallc.com. Thank you. Thank you for watching. Have a great day.